Xeomin is an ectobotulinum toxin A and is made by Merz Pharmaceuticals. It is approved by U.S. Food and Drug Administration for the treatment of adults with cervical dystonia and moderates to severe frown lines between the eyebrows. It has both medical and cosmetic uses. Xeomin is basically a protein made from botulinum toxin. It temporarily paralyzes muscles by blocking certain nerves and is an injectable wrinkle muscle relaxer. Although it is a toxin, but when doctors use it correctly in small doses, it can have many benefits. In small doses, it can reduce skin wrinkles and help to treat few medical conditions. Now worldwide, more than 84,000 people have been treated with Xeomin injections. Xeomin is considered a safe treatment. C. Botulinum bacteria, from which the Botox is derived, is present in many natural settings like soil, lake, forests, and also in the intestinal tracts of mammals and fish. As this bacterium is naturally occurring, so it is harmless. It gives some problems only when spores transform and the cell population increases. FDA approval is based on trials. Before giving approval to Xeomin for medical and cosmetic treatments, FDA has done 2 clinical trials in U.S. A study quoted in the Journal of Neurological Sciences on the effectiveness and safety of Xeomin found it safe treatment for disorder. Although it is little bit inferior to that of Botox, but still is the out of harm's way to treat few medical and cosmetic conditions. Food and Drug Administration has also approved it in 1989 to treat various health issues including excessive sweating, some bladder disorders, and also the most common disease, the migraine. In the year 2002 they also approved it for cosmetic use from moderate to severe frown lines between the eyebrows. US is actually the 20th country to endorse this new drug for cosmetic as well as medical use. Areas where Xeomin is used to get a dazzling outlook. As long as you are under 65, you always have a chance to get Xeomin botulinum toxin. It is a simple treatment to get rid of wrinkles and few other medical pains like certain eye muscle conditions caused by nerve disorders, uncontrolled blinking or spasm of the eyelids, stiffness of the arms and muscle spasm. Treat the muscle rigidity in ankles, elbows or toes. Temporarily lessen the wrinkles on the face. Chronic drooling in children at least 2 years old. Cervical dystonia. Helps in treating overactive bladder. It is not a permanent cure and your symptoms will gradually return as the medication wears off. It lasts for 3 to 6 months depending upon the patient's circumstances as well as the area to be treated. To preserve the cure, go for Xeomin sessions at least thrice a year. Warnings before taking Xeomin. According to the report of American Osteopathic College of Dermatology, the botulinum toxin is enormously hazardous. Doctors need to decide the amount of toxin and the decision to give or not to give the injection after looking at your prescriptions and medical conditions. A healthy person over 18 years is capable to take this treatment of botulinum toxin. Those who cannot get this treatment are: if you are allergic to botulinum toxin experienced earlier, especially in last 4 months. Person having any kind of neuromuscular disease should not get this toxin. Having any skin allergy near the area to be injected. Pregnant or nursing women. Any scars or uneven facial features or any change in the normal appearance of your face. Older people with less muscle tone may see results lessen sooner than those with younger, firmer facial muscles. If you have infection, any swelling or muscle weakness, any kind of bleeding or swallowing problem, or accidentally inhaling drinks into your lungs. Even though Xeomin can be health hazardous, but if it is used in a remedial framework, then it is totally out of harm's way and has very few side effects. The effects last about 3 to 12 months, depending upon the area of treatment using Botox. The most common side effects are pain, headache, upset stomach, and temporary drooping eyelids. Better not to switch healthcare providers. It is recommended not to seek more than one medical professional at a time, because when you are planning to have this injection, then before the process start you must tell your doctor about medical history and the medications you are taking. He or she will be deciding the dosage, number of sittings according to your health check situations. If you switch your provider for the next time, then it will be difficult not only for you to explain your stipulation but also not easy for the practitioner to take judgment for your treatment. If in any unavoidable circumstance you have to change your doctor, then ensure to tell your new provider about how long it has been since your last botulinum toxin injection. Xeomin is common cosmetic US treatment. Xeomin botulinum toxin injections are the most common superficial treatment in United States, and also an entry procedure for clinicians seeking to incorporate aesthetic treatment into their practice. It is given by dermatologists. However, not every dermatologist is qualified for this process. He or she should be experienced with using neuromodulators. It is a good idea to meet your medical person before your sitting of getting Xeomin. It is better to ask them directly about their experiences with botulinum toxins. They may even have a portfolio or pictures to you the exact procedure of Xeomin and to make you comfortable for that. If you consider any serious negative impact, then you must inform your doctor immediately to get the instantaneous remedial. How Xeomin is given. Xeomin injection is injected into the muscle. It is injected with a tiny needle to the wrinkled muscle. Two other injections of botulinum toxin are Botox and Dysport. They are used to target different areas of your face. This neuromodulator temporarily paralyzes muscles by blocking certain nerves. The injected muscle cannot contract, that is why it becomes soften and relax and reduce unwanted wrinkles. This injection should be given only by a trained medical professional, even when used for cosmetic purpose. Healthcare professional will give you Xeomin injection every 12 to 16 weeks to maintain the desired wrinkle-free look. As it is not a permanent treatment, so to keep up the result, injection must be redone. Xeomin injections should be arranged 12 weeks apart. Xeomin injection can be given into more than one area at a time depending on the condition being treated. Although it is a 2 to 3 minute process, but the full effect of the treatment can be seen in 7 to 14 days. One who has taken injection of this toxin must ask his doctor to avoid the activities immediately after this type of treatment. What should be avoided before and after Xeomin? One who has taken injection of this toxin must ask his doctor to avoid the activities immediately after this type of treatment. Few precautions before the process are: 1 should stop taking alcoholic beverages at least 1 week before taking an injection of botulinum toxin. Inform your doctor regarding all of your muscle or nerve conditions. Stop taking any anti-inflammatory medications like aspirin, ibuprofen, and vitamin E at least 10 to 14 days prior to the procedure. These drugs and herbs may cause excessive blood loss or staining. Schedule your Xeomin appointment at least 2 weeks preceding to your special event like marriage or vacation. Because the procedure will take 5 to 7 days to appear on the treated area. If you have a cold sore, you must inform your doctor to put an antiviral medication before the Xeomin treatment. Be sure to have a proper food before going for a treatment, that will decrease the chances of lightheadedness during the treatment. Small number of precautions after the process is: after taking injection, avoid rubbing the treated area for at least 24 hours to stop spreading Xeomin to another area. Keep away from doing exercise, straining and heavy lifting for at least 6 hours of the day of treatment. Do not lie down for 4 hours following the Xeomin injection. Doctors also suggest staying upright for a few hours after injection. Avoid excessive heat, hot bath and out to sun for 72 hours after getting botulinum toxin. Treatment may cause general failing of muscles, double vision or dizziness for a few hours. If this happens, then do not drive a car, operate any machinery, or do any other hazardous activities. Units and cost of Xeomin injection. Doses of this injection are measured in units. A single unit is a measure of the outlined amount of toxin to a set number of treatment molecules. Basic guidelines of Xeomin units are 20 to 40 units for the horizontal lines found on the forehead, 5 to 20 units to treat the crow's feet around the eye area, 15 to 30 units for frown line between the eyebrows. Every patient is unique for this treatment. Number of units may depend on certain factors like skin, muscle strength, age, and gender. In America, average cost of Xeomin to the patient is $425. This cost may vary depending upon the size of area to be treated, the number of injections, and certainly the geographic location where one is going to have this treatment. As it is an elective treatment, so the health insurance does not cover the cost of injections during the Xeomin treatment. Few side effects of Xeomin. The botulinum toxin contained in Xeomin injection can spread to other body areas further than where it was injected. This can cause serious side effects and can be health hazardous. Otherwise, if used properly by following doctor's precautions, then it is a safe treatment and will certainly give you a stunning look. Most of the side effects go away by passage of time. If they don't, then you must consult your practitioner within no time. Negative impacts may include severe or unusual muscle weakness, blurred or double vision, tightness in your chest, trouble in breathing, eating and talking, loss of bladder control with a feeling like you must pass out, increased blood pressure, cold symptoms such as cough, chest congestion and stuffy nose, little pain on the injected area, muscle pain and a tiring feeling, sore throat, runny or stuffy nose, dry eyes or drooping eyelids, pain in spreading the arm or shoulder.